Okay, so we're back on. I don't know how long, but we'll wait till everyone gets out of the waiting room, and we'll go ahead and start the quiz, you all. Time, hopefully it won't. So you can go ahead and start the quiz. I'll set a timer for 15 minutes. The quiz has been published. So I'll let these two in. Hopefully I don't lose y'all again, but we're gonna make our time. Okay, everyone is in. You don't have to worry about typing your name in the chat again because everything is timestamped. So go ahead and log into the course. I'm gonna mute, but you can go ahead and start your quiz.
Recording in progress.
Okay, so our time is up. Good evening to everyone. I'm going to go to plan B because I'm not sure what this connectivity is going to do. So we're going to play the game 21 questions. It might not be 21 questions, but it might end up being that amount. So make sure you leave your cameras on. If you have to go to leave for some reason, just put a message in the chat as usual. So our exam is on next Friday. All right. And so still sign up. Let's communicate if you want to do that one-on-one. So 21 questions without further ado. Like I said, I don't want to lose time. Hopefully we don't get dropped, but I'm just going to move forward. I'm not going to do my interactive thing because we might get dropped again. So psychomotor learning. So what do you know about psychomotor learning? In order to say that someone has successfully mastered psychomotor learning, what are some things that we should see, some characteristics of that? Psychomotor learning, you all. So psychomotor learning is dependent on the learners meeting some conditions, and that is having the ability, including the cognitive ability and the psychomotor abilities, having sensory image of how to carry out a skill, having the opportunity to actually perform that new skill. So if I were to ask you, which of the following are characteristics of psychomotor learning, would you select the necessary ability to perform a skill? Would you select that? Okay, I see heads up and down.
Yes.
Yes.
Great. Would you select desire to learn a new skill? Okay, I see some heads going from left to right. That's correct.
No, because that's not carrying out the skill.
Got it. Great. What about opportunities to practice that skill for psychomotor learning?
Yes, I would say yes for that one.
Great. That's correct. 21 questions. So one down, 20 to go. Okay, so we are talking about learner related barriers. So what is a barrier? What is a barrier?
Like language, what they speak, like English, Spanish, language barriers.
Okay, so anything that prohibits or stops or slows down, I want to say progress, but in essence, we can say progress, or the ability for a person to move forward toward a favorable end, whether or not that is not speaking English as the first language, whether or not that is low literacy, whether or not that is a disease process that has a person incapacitated at that moment in time, is whatever that is that's preventing that person from being able to learn at that moment in time. And sometimes it's just, we just don't have enough knowledge about something. Some things we have low literacy in. So what might someone say if they have low literacy and they don't really want to tell you that, but you're trying to see if they really did understand the information that you gave them. And so here's the scenario. You're trying to give them a pamphlet and they're saying, oh, what might they say if they have low literacy? You tell me what they might say. They have low literacy. And
they may say they're not interested in the pamphlet or they don't need it.
Yeah.
Exactly. I don't like to read. Just tell me what I need to know. Just tell me what I need to know so I can go.
Yeah.
Statements like
dismiss it.
Yes, dismiss it. So statements that dismiss whatever it is that you're trying to give them, instead of saying, hey, I have a problem. I can't read. I don't understand well. And so they might say, I don't like to read. Just tell me what I need to know. So that is an example of low literacy, and it is considered a barrier to learning. So anything that prohibits learning from taking place, a person being able to take the instructions or the information that you're giving them and being able to do those things that you're giving them. Any questions about those two concepts? We talked about psychomotor learning, and we talked about learner-related barriers. So remember, when we are talking about concepts and we're trying to identify what the question is wanting us to answer, look for those keywords like barrier, all, priority. Just keep those things in mind. Okay, so if we are trying to assess a person, one of our patients' ability to read and comprehend written instructions, what can we do? Just give me a scenario about what can we do to assess that. They haven't told us, but we really are not sure that they just told us. Just tell me, I don't like to read. Just tell me what I need to know.
Just assess their how they learn.
Okay, so yes, so you might give them the instructions and say, hey, this is what we have about whatever it is that we're talking about. I do understand, because this is medical stuff. Sometimes people have a hard time understanding these written instructions. Would this be helpful for you, or do I need to get some other type of instructions or give you information in a different way? So that's a way of actually bringing to the forefront of what really probably is going on, but really not saying it and giving them the opportunity to actually say it to you. So again, so you are trying to assess a patient's ability to read and comprehend written instructions. So you're really not sure, they just told you, just tell me what I need to know. So you can say, with your printed information, you can say, some people do have difficulty with written instructions. Other finds them kind of helpful. Some people like things written down so they can refer back to them, so they can mark on them. Would this be helpful for you? So that's a more focused conversation with a person that you think that they might have low literacy. It might be an issue or a barrier for them. So that conversation should go something like that. Okay. So we are still on patient education and health promotion. That's the topic that we're talking about. Everyone with me so far? Okay. Make sure you're taking real good notes now. Real good notes. Exam 3-2 is next week. And this is the concepts narrowed down. Okay, so we have a patient that has, we'll just say diabetes. And so they've tried the medication and the diet, and the doctors have said, well, okay, we do need to put you on the shots. And the patient tells you, I don't think I'll ever be able to give myself an injection. What should your reply be?
What are your concerns about it?
Or why do you feel like you can't? What is prohibiting you from thinking you can?
Okay, so asking those specific focused questions. What bothers you most about the idea of giving yourself an injection? So you're not talking about other things. You're specifically saying, hey, what's bothering you about this? So yes, asking those focused, purposeful questions when you're going in to do your interviews and when you're doing your patient education is really, really important. All right, so you do have a patient that they're lacking that confidence, and you're trying to explore their feelings. And so that's what your focus should be with that conversation. We want to just be more focused and just getting them to kind of just really just say it. You want that's another way of trying to establish and gain that rapport and trust. When does discharge begin? Planning discharge.
As soon as they come in the hospital.
Exactly. As soon as they're admitted. Now, will your plans change? More than likely. But yes, once a patient is admitted, that's when discharge planning should start. You should start trying to foresee and think about, okay, this person's going home. Right now, they have this disease process. What equipment do they need? What services do we need to try to go ahead and set up? Do we need to will they qualify for rehab? Will they qualify for a 21-day rehab, long-term, short-term? So from the day that they come in, that's when discharge planning should start. Okay, that's patient education and health promotion. Any questions about that? Okay, good. You all done really well with these. Okay, so let's look at spirituality and culture. Okay, spirituality and culture. Let's see. I don't know what number. We start off with 21 questions. I'm not sure what number we down to now. 15 more questions. I'm not really sure. Okay. So if we were to say you are practicing in a culturally competent manner, what would someone really be saying about you? You are a nurse that practices in a culturally competent manner. That is one that does what?
You're aware of all the different cultures that people have and their different religions and things like that.
And being aware of our own beliefs
Yes.
or
You're-
culture.
Yes, you're looking at the world through the eyes of a culturally diverse client. So you have, first of all, you have identified what your beliefs are. Then you have done your homework, you've studied, you've had those focused conversations so that you can gather more information from your client to learn more about their culture. You've done your own homework, you've done some reading to find out. So if one would say that you are a culturally competent nurse, they would say, oh, he or she looks at the world through the eyes of the culturally diverse client. Do we have any questions about that? Okay. So what are some barriers to culturally competent nursing care? We got that word again. So what is a barrier? So we just said that it requires that we have an understanding of our own culture and our own biases and our own stereotypes that we don't realize we have. So we have to identify with what those things that how we feel and think and believe. So what are some barriers?
Not taking the time to learn the other cultures.
Okay. And not taking that time leads to us having a broad understanding or a limited understanding of other cultures.
Limited.
Mm-hmm. And it leads to us to doing some assuming cultures. People believe one way and they really don't. So one
being
assumption.
unaware.
Go ahead, Ms. Urban. What you say?
No, I was just saying basically being unaware
Unaware, exactly.
of others and yourself.
Okay, true or false? Is the following a barrier to culturally competent care? True or false? Is the following a barrier to culturally competent care? Assuming cultural beliefs are based on religious affiliation. Is that a
True.
barrier?
True.
Say that again. Is that a barrier? Assuming cultural beliefs are based on religious affiliation.
Yes.
Yes.
That is a
Yes,
barrier,
definitely.
yes. Just because someone has a certain religious affiliation, it does not mean that they are specifically this in culture or have these certain beliefs. That is a barrier. True or false? Believing that one's own, meaning you, the nurse, culture is superior or any other culture is superior to others. Is that a barrier if you think like that?
Yes.
Yes.
True.
Okay, that is correct. Any questions about that true or false information we just went over? Okay. So then, in the reading, we talked about past, future, and present oriented thinking and cultures, people-based decisions based on how they're thinking, whether or not if they're past oriented, present oriented, or future oriented. Someone explain those concepts to me. If someone's making decisions based on past orientation, what are those decisions based on? Things that's happened when? That's not a trick question.
In the past.
In the past.
In the past, exactly. So they're here in the here and now, but the decisions they're making are based on information or consequences or situations from the past. Exactly. So what about present oriented culture decisions?
Based on the now.
Here and now. Present oriented cultures value the here and now. They're prioritizing quality of life and making decisions that make them happy right now. They are not considering things that happened in the past. They're not thinking forward to the future. They're not taking it all and shaking it all up and thinking, weighing pros and cons. Nope. The here and now, this makes me happy. So what about future oriented cultures?
Future.
The future.
Exactly. Those are not trick questions, you all. Specifically, past, present, future, future. So let me form a question. So the nurse, you're the nurse and you're completing education, incorporating cultural diversity into your nursing care. When reflecting on culture and time perception, which outcome may be associated with present-oriented cultures? I'm gonna give you two choices. So you're the nurse, you're completing education on incorporating, you're trying to incorporate information about cultural diversity into the nursing care. When reflecting on culture and time perception, which outcomes may be associated with present-oriented cultures? Let's see, number one, being present-oriented may lead to a preoccupation with past events. Or number two, present-oriented culture beliefs may lead to decision-making processes that fail to plan for the future. Past, present, future, future. So the question was about present-oriented cultures. Are we going to select statement 1 or 2?
Would it be B as in boy?
Okay, we'll select 2.
Second
Yes.
one.
So present-oriented culture beliefs may lead to decision-making processes that fail to plan for the future. They're thinking about, we just said, the here and now. Forget about what happened in the past. I'm not thinking about what's going to happen tomorrow or next month. Yes, that was not a trick question or statement. Some things it is what it is. Okay. Any questions so far? So what are some things that we can do to improve cultural competency for our own practice? What are some things that we can do? We said first identify with our own beliefs, but tell me some more information. What else can we do?
We can try and educate ourselves about the patient's beliefs and about their culture.
Mm-hmm.
Is getting an interpreter kind of like one? I mean, if there definitely is a language barrier, making sure that you have someone in there to interpret everything that you're trying to explain.
Okay. What else? Identifying resources, no matter what they are. So by doing that, are we treating our clients as a unique individual, or are we treating them like they're all the same if we're identifying resources that will help us
A
to
unique individual.
a unique individual? Yes. And so that in itself improves our cultural competency when we approach each client as though that they are a unique individual. We're gathering data about their client, about our patient's beliefs and their expectations. Because we can go in, we have our little bag, we got our little plans written out. And what you have planned, that's not what they're expecting. Your client is wanting A. They're not wanting B through Z. They just want A. So gathering data on the client's expectations and approaching each person, each client as a unique individual will help us to provide that cultural, competent care. All right. Any questions so far? Gotta watch my time. So what we'll do is to make up the time, you can either stay on or either just meet at an alternate time because I was short. Was it 20 minutes? And so you can leave at 9:30 or we can press on and make up those 20 minutes, but you will not be penalized because it was my connectivity. Okay, so let's go. We're down to what, question number 20 now? We're on question, we have 20 more left. So we back at question number 1. No, I'm just playing you all. We're halfway there through reviewing the concepts. All right, so here we go. So you have a client, they are working, they have children, they are living below poverty, but they're going to work, they have several children. They do not have any health insurance. They don't have the Medicaid, Medicare. And so what are some challenges that mom and that family will come up against? What do you think? In realm of
Wellness, like
healthcare,
wellness checks?
will they be getting
If-
those wellness checks?
Probably not, and they probably won't get immunizations either.
Exactly.
Financial insufficiency.
Okay. Anything else that comes to mind?
Increased health related concerns.
Okay. So that family would more than likely be more concerned with surviving day to day. They're not, insurance. If something happens, more than likely, where would they seek health care at in the event that something happens to them? Where are they going to go?
The
Emergency
emergency
room.
room.
The health center.
Emergency room. Remember, we said the emergency rooms because if they don't have the insurance, they're not getting those preventative well checks and things done like they normally would. So most times, are the disease processes well advanced when they go to the emergency rooms, or is it something that's probably just happened?
Advanced sometimes.
Advanced.
Most times.
Yeah, most time is advanced because if they put it off, they just don't have the funds. So they're just trying to survive, just making it day to day, getting through the day. All right. So tell me about Native Americans. What are some things that we should know or remember about Native Americans, and more particularly eye contact? Tell me what about eye contact?
You want to avoid eye contact.
Okay. So that is true. They do consider it to be rude if you sustain that eye contact. So they do not usually sustain eye contact. They find direct or sustained eye contact, continued eye contact, to be rude or disrespectful. And that's just their belief. It doesn't make them any different than, anyone else having different beliefs. But knowing that will help you provide that culturally competent care. If they're looking away, don't assume anything is wrong. That's just part of their culture. All right. You all are doing really well with that. That was spirituality and culture. We have about 18 more questions left. Let's talk about care of patients with substance-related and addictive disorders. So tell me, what do you remember about blood alcohol concentration? We gave you in your study guide, we gave you some specific information about whiskey, wine, beer. Tell me about those blood alcohol concentrations.
Wine concentration would be higher, wouldn't it?
Wine or beer?
Wine.
Whiskey.
Oh, I thought it was wine.
Okay, so the amount of alcohol the liver can metabolize per hour is equal to about how much for whiskey?
0.25 ounces.
Okay, so in an hour time, it can only get 0.25 processed. So what about wine? How much can the liver metabolize or process in an hour for wine?
4 ounces.
4.
4 ounces. So You know, you don't have to share information, but just think about a glass of wine. A glass of wine is usually probably how many ounces? How many ounces you all a glass of wine really be?
Like 8.
Okay, so 8. So how long would it take that body, that liver to process just that one glass of wine?
2 hours.
Exactly. So it is, so that's what the blood alcohol concentration is trying to get you to understand. It takes the body that long, even though we consume just like all this food that we eat, it takes the body a certain amount of time to break through those things down. So, okay, so what about beer?
Excuse me, how many hours was that, Dr. Ford?
The amount of alcohol the liver can metabolize per hour is equal to about 0.25 of whiskey,
Mhm.
4 ounces of wine. So if we're saying that a glass is 8 ounces and it takes 1 hour, then this is not a math problem, y'all. I'm just trying to get you all to think about, you know, what is the liver doing? What is the body doing? We consume these things, or one of your patient is consuming alcohol at large amounts. What is it doing to the body? So this is what this question is all about. So just trying to get you to process that part, not a math problem. Okay, so let me go back. The amount of alcohol the liver can metabolize per hour is equal to about 0.25 of whiskey, 4 ounces of wine, and 12 ounces of beer. This is per hour for each one of those. So the liver can metabolize 4 ounces of wine per hour. Need to know that. Specifically for blood alcohol concentration, you need to know the amount that the liver can metabolize of wine. But we added the other information in. So if a person is consuming a large amount of beer, and I don't even, how much is in a can of beer? How many ounces is that? Do anybody know?
I think it's 8
It says 12 on the paper.
or 12.
No, I'm saying how much is really in a can of beer though? Is that how much is in a can of beer? That's
I
12.
think there are 8 ounces.
Okay, 8 ounces. So if a person is drinking only 1 can of beer and it's only 8 ounces, so they would, the body is actually metabolizing that whole can within that hour, because it can metabolize 12 ounces of beer within 1 hour. But again, we're not doing any math. I just want you to know, just to understand that concept of that blood alcohol concentration in reference to the liver being able to break it down, and so that it can be dispelled from the body as a waste product. So it takes a while. So if someone's just compulsively just drinking, so that's why you see the different symptoms. You know, the person's sluggish speech, they can't drive, they can't focus, because the body can't break it but so much down at a time. But the key takeaway is the liver can metabolize 4 ounces of wine per hour. Okay. So what do we know about e-cigarettes and children? Tell me about e-cigarettes.
They're poisonous to children.
They are poison. It's a poison. So what about the actual device? I don't know what you call them, cassettes. That may not be the correct term. But what if the child actually picks that up? Is that harmful, or is it just harmful when the parent or the person is actually vaping?
The oil itself is harmful to the child.
Exactly. That oil is poison. It's specific, it's poison to that child. So you want to do some teaching and just saying, hey, you know, you don't even want the child to even come in contact with the containers that the oil is in, the actual vaping device, because it is the risk of poisoning is there for that child. Yeah. All right. So tell me about methamphetamines. Do they increase or decrease bodily functions? Methamphetamines and amphetamines, what do they do?
Increase.
Yeah, so they speed up things, body processes in the body. So when would you call like an ambulance, or if you know one of your clients is on methamphetamines and you go in to do a house call, a welfare check,
If
and
they're unresponsive.
unresponsive, what's some other things you're there? Okay, so what if you're sitting there talking to them and they just say, oh, I am feeling some type of way, and you check their vital signs.
If
When
they have tachycardia, you will call 911.
the heart rate is up, and what other vital sign which is considered
Blood pressure.
Respiratory depression.
Remember, methamphetamines and
Or
other
increases.
it's
Oh,
gonna
the heart
increase.
rate spikes.
Heart rate, tachycardia, like she said, and which other one might be high?
Their blood pressure.
Body temperature.
Body temperature. Yeah. So the blood pressure might be up too. But the key thing is all those things more than likely will be elevated. Blood pressure, temperature, heart rate. That is the time to call an ambulance or 911. Seek emergency services. So tell me about if someone's going through withdrawal. So what are some symptoms, signs and symptoms that you will see? What would that person be?
Irritable.
Diaphoresis.
Okay. What else?
Are we speaking on all withdrawals or just like a certain substance?
Nausea, vomiting, abdominal pain.
Alcohol, I'll narrow it down for you. A person that has not had any alcohol within the last 12 hours. So we're looking at early signs.
Irritability.
Irritability. Just because it's just been 12 hours, just long enough to just, feel that, we need that other drink. So particularly early on, irritability. Yes. So you are encouraging your patient to participate in a group therapy and they are an alcoholic. Which benefit would you discuss or tell your patient that would be what would you say to them to say, to convince them to go ahead and participate with that group therapy? What might you mention to them? Which benefit?
I guess you could learn. Ooh.
Maybe it's like being around other people that are going through the same exact thing that they are.
Yeah, like building a sense of
Or like
community.
sobriety.
They learn discipline.
Discipline, yes, and you all of you are leading that way exactly. So you may tell them, hey, the most important thing is it should increase your self-discipline for you being around others. It should encourage you, and so at the end of the day, your selling speeches increase that self-discipline for that person that's that alcoholic, and you're trying to convince them to go to that group therapy. Good. Okay, so you suspect one of your coworkers is using methamphetamines or amphetamines. What kind of behavior would you probably see if that person was using that?
The part would be a little hyperactive or rapid pressured speech.
Exactly, because we just said those things.
Frantic speech, yeah.
Yeah, so we just said those things kind of speed you up. So if you see your coworkers buzzing around them, they just saying stuff like, what is she talking about? That speech is all over the place, frantic, excited speech. Now you would not see poor personal hygiene because those are downers. So this particular drug hypes the person up. So you would not see anything like that, appearing tired at work or poor personal hygiene. So if a person is on methamphetamines or amphetamines, you'll see the behavior would be something of hyper. So when you are test taking tip, when you're reading through your questions, identify the concept. What is the concept this question is talking about? Methamphetamines, a learning barrier. So think about that main concept. And then the second part of the question, what about that concept do they want me to select an answer for it? Are they wanting me to select something that is incorrect or correct? For example, should more learning, select a statement that indicates that learning took place. When you're reading your answer choices, you're selecting something that the client is saying that is correct, or are you selecting something that the client is saying that is incorrect?
Correct.
Right.
All right. So the question says, select an answer choice that indicates learning did not take place. You are selecting an answer choice that is correct or answer choice that is incorrect.
Incorrect.
Correct.
So when you're reading your answer choices, look for those little keywords that will make the answer correct or incorrect. For example, if the answer choice says blah, 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 all, you're like, wait a minute now. Is this for this particular concept? Is this all the time that this will happen or just some of the time? So if the answer choice is partially incorrect, do not select that. That's not the correct answer choice. All right. So we are down to our last few minutes of class. So I have a few, we almost made it to our 21 questions, just a few more. I think we just have 4 more. So our focus this time is on mental illness. So tell me, what do you know about bipolar?
They have like manic modes.
Okay, what else?
They experience periods of either mania, like where a person might go out and do something crazy, like they'll buy a house just because they're like real manic at the time. It may go charge up $20,000 on a credit card, things like that.
Okay, right. So many times they will be on lithium, which is a mood stabilizer for bipolar disorder. And so when we do client teaching, what are some things that we want to include in our client teaching if a person is on lithium?
Walrus.
Don't stop it abruptly.
Take it at the same time every day.
Okay. What else?
Allow 3 weeks for it to actually start working.
Okay.
Avoid alcohol.
And
Okay.
if at any time, if you feel suicidal, you need to call 911 or contact your physician right away, because sometimes those medications can cause a person to feel like suicidal, even though they're not.
Yes, and it was, I forget it's been a commercial, not here lately, but that was the main thing at the end of the commercial. It said, you know, that medication, I can't think of what, it wasn't lithium, but some medications can trigger things. So yes, providing that education. You want them to continue their normal diet intake, just normal intake of salt. Do not overdo it with the salt. Encourage normal salt intake. And you want them to report diarrhea, vomiting, tremors, or any lack of coordination. They need to report all of those things. You want to encourage normal salt intake, report diarrhea, vomiting, tremors, or either lack of coordination. Any questions about lithium and bipolar? Okay. All right, so I'm going to read this scenario to you. So Abby is being seen in the clinic today because she needs a school physical. You know, that that once a year physical, they need basketball, volleyball. I'm not sure what she's actually playing. But she's a part of that all-star team at school. When asked to step on the scale to obtain her weight, she is hesitant. Her weight is 144 pounds and her height is 6'6". What is an appropriate nursing assessment, a recommendation for this, for Abby? What would you recommend at that moment in time? What should you go ahead and do? Say that again.
Maybe just ask her how she's feeling and why she's hesitant on getting on the scale.
Okay. So what is wrong with that 144 pounds in
Her
the
BMI is too high.
She may be anorexic.
her BMI is exactly so is low. She's below weight. So that's probably why she was hesitant. She probably already knew. But you know, it might be, you know, fast metabolism. She's an athlete because she's getting her physical. So it might be that she's just one of those persons that works out really well, because we do know heart rates with athletes are a lot of times, if they really, really are in shape and they're, you know, they have that regimen going, their heart rates are low. It's not because, you know, they're on some medication or doing something wrong. It's just that they're so conditioned, that heart is just relaxed. So it could be that she's so conditioned that she's at height and that weight, she's eating properly, and that's just how it is. But how do we want to, what should we do to ensure that she is getting enough nutrients? What kind of assessment should we complete? We as the nurse, what kind of an assessment should we complete? And I can say it again.
A nutritional.
A nutritional assessment. So our concern is the weight and the height, the BMI. She's a little bit on the low side for weight. So she's below weight. So it could be that, you know, she's eating fine, getting the proper nutrients, and it could be that, but we need to further assess. What is that assessment that we will do? We will complete a nutritional assessment. So again, identify what is the concept. So remember, for community, you're bringing all the tools that you have from OB, Peds, med surgery, bringing all those things over to community, because where are our patients now? They don't stay in the hospital. They don't stay at the urgent care center. They come back home. And so we know as a community nurse, we will work in schools, we'll work in different industries, we'll be that occupational nurse. So this is not new information. You're just applying what you already know, just in that, whatever the setting is. Okay, any questions about that? No questions? Okay, so tell me about generalized anxiety disorder. What do we know about that? Generalized anxiety disorder.
People
That's
just
pretty
worry
common.
a lot, basically, for the most part.
Say that again.
People with anxiety tend to worry a lot for the most part.
So
It's a common disorder.
say that one more time.
It's a common disorder.
It's a common disorder. You said tend to worry or be anxious a lot. So is what they're worrying about, is it something that's rational or irrational?
Irrational.
Irrational.
Okay. And do they have signs and symptoms as though that something is really physically wrong if they have generalized anxiety disorder?
Yes,
Yes.
definitely.
So, exactly. So they'll present themselves, they'll have the uncontrollable shakiness, they'll be unable to concentrate, they may even have palpitations, not sleeping for days and days and days. So this is not just, you know, just a little worrying, you know, gets on your mind, get off your mind. This is a full-blown, and when you go in to see the patient, you see some signs and symptoms. You know, like I said, again, they have the uncontrollable shaking. They're unable to concentrate. They're telling you they feel their heart about to jump out of their chest. They have the palpitations. They will report that they haven't slept in 2 or 3 or even more days. And so those are some characteristics or some symptoms of generalized anxiety disorder. It's not just, you know, a fear about something here and there. Good. You got to really good with that one. So I think we have 2 more questions. We have 3 minutes. I think we'll be able to get complete with our 21 questions. All right, so here we go. You have a patient that has been taking Buspar for 1 month, and they're returning to the clinic for a follow-up. The nurse determines that the medication is effective if the absence of what has occurred. We're talking about Buspar. What do we know about Buspar? What is it given for?
It's an antidepressant.
Okay.
So they would have symptom or absence of like depression or suicidal thoughts.
Okay. So the absence of what is given for, the absence of the anxiety, the absence of the rapid heartbeat, because we just said those, sometimes people will present and they'll really have full-blown symptoms. And it is just that they're so anxious about something. So someone mentioned earlier, give the medication 6 weeks. So yes, so getting toward that 1 month or that 4-week mark, the patient should start seeing they're not as anxious. They're a little bit more calmer. The heart is not racing as much. So what is that main concept? That medication What is it supposed to do? It's given for high blood pressure. So when you take the blood pressures, what should you see those blood pressure numbers be? They should be more toward the normal side, the therapeutic side. Are you all following how I'm trying to get you all to look at concepts and then identify what you already know about it? You all are just full of knowledge. It's just that you have to just think about what you're thinking about. Well, how, what is it about this concept that I need to answer? All right, so one more minute. We got one question. We did our 21 questions. We did it. And again, if you want to stay on after 9:30, we can just go over some other things and or go back over this, or if not, you can feel free to log off. Okay, so here we go. The 21st question. Ooh, you all just been doing well. In the midst of our trying times we had tonight, I didn't know what was going on. The weather, the connectivity, all of the above. But I do appreciate y'all hanging in. You all were sending me text messages. Are you okay? Great. Thank you. Thank you. Thank you. All right. So here we go. Clients being seen is being seen, and they are noted. You're looking at them. They have a flat affect. So what's a flat affect anyways? What does that look like?
Almost like they just no emotion, no feeling, just nothing. They're just, the lights is on, but nobody's home.
Okay. All right. So then they tell you, hey, I am a superstar. And then they start hurrying you through the visits. I got to get on a jet to go to Hawaii. They're beginning to be agitated. They're just talking nonstop. But you're in trying to do your head to toe assessment, trying to ask her questions. What would you say to that patient to help them refocus so that you can get that information so that you can relay it to the doctor? What's your comfort? Let me hear what you would say to that person. We'll give him a name. The patient's name is Larry. Larry Bob. His last name is Bob. What would you say? Mr. Bob, what?
I personally will reorient to the time, the place, like, let them, bring them back in. Like, let's reel this conversation back in. I wouldn't be rude like that, but I would, that's what I would do to, hey, you at this hospital, this is the day, you're scheduled to see Dr. such and such. Can we finish your assessment so we can come in? The sooner we finish this up, the sooner you can talk to the doctor.
Great. So you're saying we focus that conversation. Mr. Bob, I'm trying to collect information to share with your doctor. I need you to focus and answer the following questions. Question number 1. Would you give me the answer to that one? So you have to refocus that person. You don't have to, I can say, be disrespectful in what you're saying, but be, stern, clear in what you're communicating and what you're wanting them to do. Just refocus them. Hey, you got a lot of information, but I need you to answer these 3 questions for me so that I can give this information to your doctor so we can figure out what we need to do to take the best care of you. Great. You all did great with those 21 questions. And I was going to actually flash them on the screen, but you all did better, I think, with the back and forth conversation. You heard others talk, so it piqued your interest and made you think about what you already know and the things that you need to go back and review. Our time is 9:32. We will have the exam on next week. As I think another review session did occur, so I'll look and I'll post that recording. I'll share that link with you. And if you so desire, please send an email or communicate in some type of way if you want to meet one-on-one so we can get it all reviewed before next week. You all take care and we'll see you soon.
So this video is going to be posted, right? Just want to make sure.
Yes, I post all of them. They're
Okay.
there. Okay. So
Okay, thank you.
let me start recording. Hold on. Let me start recording.